I'm certainly happy to see all of you here in the room. Let me also echo the comments that were made by the two previous speakers in terms of the direction, their poignant facts about our respective communities and some of the challenges that we all are now facing as we move into, moving forward with the Affordable Care Act and particularly with this health insurance exchange. As a legislator, I think when I see a room of people like this, I'm thinking about advocacy and what that really means and how each of you should be engaged. Generally in rooms like this, I always ask how many of you know who your legislators are. So I'm just going to assume that all of you know who your legislators are and that you are in constant communication with them in one way or another. But I think that's really what this conversation, at least for me, is truly all about. It's about asking you exactly what is the conversation. What exactly are you saying to your legislators? We all know Springfield. Those of us that have been in Springfield, in and out of Springfield, know that the lobbying effort there is really what drives a lot of what happens in Springfield. We've heard a lot about the efforts of the insurance industry and how strong those efforts are. That's true in some respect, but I would not want to take anything away from what this group and others like this can do in Springfield when it comes to advocating and really taking charge of pushing an agenda that helps average everyday people. And again, it just goes back to what's your conversation. And sometimes what I see in Springfield, and it's kind of disheartening, is that you see large groups of people in Springfield, they all have on their purple or yellow t-shirts or whatever the case may be, and they call you out and to share information with you. But when you start asking them questions, they really can't say anything. They can't answer any of those questions. They can't provide you anything more than, here, let me just give you this sheet of paper. That's absolutely the wrong way to do that. If you are truly going to be effective in Springfield, you have to know and understand exactly what it is you're talking about. You have to be able to do that. You have to be able to share some relevant information about exactly why you are there. Don't assume that because you have on a purple t-shirt and 200 or 300 other people have on a purple t-shirt in Springfield that I'm supposed to know what that means. And it's amazing when you engage the people who want to talk to you, how little they know about really why they're there. Let's not sleep on this opportunity right now. It obviously takes more than just what's in this room, but let's not sleep on the opportunity that's before us. My conversations with some of my colleagues, and I mean colleagues that are in this room, like Mr. Al-Nurdin from the Healthcare Consortium, I don't know if Ms. Artis is in the room from the Southland Healthcare Forum, and other groups like that. One of the things that they point out to me relative to health insurance exchange is about the job opportunities. That's something that our community needs, not just the idea of healthcare, and that's very important, but what about the job opportunities that can come along with this, the level of training that goes along with this. So when we talk about small business opportunities, here's one staring us right in the face. Or for organizations, and I'm an advocate of the nonprofit sector also developing for-profit pieces. That's something that I encourage many non-for-profits to do, is really think about it. One person that you probably should have address a group like this, Jim, is Sharon Matthews from Healthcare and Family Services. She wants to provide information about how much money is going to be available, can be made from their department ongoing with some of the insurance things that are taking place right now. So jobs is a very, very important part of the health insurance exchange, not just providing information, but also providing jobs. I believe Mrs. Arline Bradley talked about cultural competency. Well, think about it. In your respective communities, you're going to need people that have the cultural competency to be able to explain, these types of things to the people that you're talking about, to the people that we're trying to help. So that's why jobs for me is extremely, extremely important. But again, just thinking about, I think, why I'm here, not so much because I chair a certain committee or not just because I chair the Black Caucus, but just as a legislator. Whenever I have the opportunity in front of an audience like this, I'm always talking about advocacy. because I truly believe that advocacy is really what drives or can drive what happens in Springfield, not just money. I mean, it's out there, and we understand that, but it's not just money. And I think some of what was said earlier about really how you address your audience and the manner in which you address your audience is very, very, very important. And sometimes you might have to lead with that. You know, 58% of your constituents think that this is important. That translates into votes. I mean, that's, you know, if I wasn't sitting here, you know, and somebody said that that was what was said to you, I would go, that is absolutely correct. I mean, all of those things are extremely, extremely important. So again, and I didn't write down much, but I did write down what is the conversation. And it's very important that once you leave here, and however you decide to put it together, you have to determine what your conversation is as you go out and start to do this advocacy to your state reps and to your state senators. And please, please, just know what you're talking about when you approach them. The last thing you want to do is for have someone start asking you questions and you can't necessarily answer those questions or provide some relevant information about the topic at hand. You know, saying I'll get back to you is not always the right answer. It's not always the right answer. So again, thank you very much for your time and your energy and your attention to this matter. Obviously, there's a great deal of work to be done. I certainly hope that the Campaign for Better Healthcare will utilize our Health Disparities Committee as a way to start having these conversations and bringing this information forward. We can schedule subject matter hearings as necessary out of Springfield, in Springfield, wherever the case may be, so we can start to bring all of this information forward and not just rely on, say, the insurance committee to do it, because we kind of understand how that conversation is going to go. So let's look outside of the traditional channels and let's look at creative ways in which we can, again, begin this conversation. And unfortunately, we don't have a lot of time, folks. So let's increase our learning curve exponentially about this information, and let's really get out into our communities and do what's necessary to make sure that our communities are taken care of in this process. Thank you all very much.